Well, celiac disease can be a difficult disease to recognise because the symptoms are so varied. Traditionally, the symptoms have been seen to be gut-based and involve a loss of weight. But actually now we know much more about celiac disease. We know that many people present to the doctor who are actually overweight, whose main symptom may be nothing to do with the gut. It may be around anemia, it may be things like mouth ulcers, or indeed we know now that some people actually have neurological problems. So our advice to healthcare professionals is to be very familiar with the range of symptoms that can exist with celiac disease, and to be very familiar with the associated conditions. So for example, if you have type 1 diabetes, you're more likely to suffer from celiac disease. The other thing that we know happens is that a lot of people get misdiagnosed with irritable bowel syndrome before they get their proper diagnosis of celiac disease. Today, the guidance from the government on irritable bowel syndrome is that you should actually have a test for celiac disease before you're given that diagnosis. So we would urge healthcare professionals to make sure they're following that advice, and if they have already diagnosed people with IBS or irritable bowel syndrome and they haven't carried out that test, then they should do so now.